All right, let's get right into it. We're going to be talking about complementary and alternative medicine, or CAM. Think of this as your practical guide to navigating what your patients are really taking and, more importantly, how to keep them safe. So here's our game plan. We'll start with the big hidden problem, what your patients aren't telling you. Then we'll break down what CAM actually is, who's using it, and finally, we'll talk about the most important part, your absolutely critical role in all of this. So let's just start with a reality check. I want to talk about what's actually happening in your pharmacy right now with the people you see every single day. Okay, look at this number. A 2010 survey in Canada found that nearly 3/4 of people were using natural health products. Now, even if that number has shifted a bit, we're still talking about a massive, massive number of your patients. And then there's this number, less than 1%. That's the estimated number of those same people who actually tell their pharmacist about it. The gap between those two figures is, frankly, pretty terrifying. That gap, that huge disconnect between use and disclosure, it creates this giant, invisible safety risk. It's a massive blind spot that exists right at your counter, and you're the only one who can really shine a light on it. So, to even begin to tackle this problem, we all need to be speaking the same language. The terms around CAM can be kinda confusing, so let's just quickly nail down the definitions so you know exactly what we're talking about. These distinctions are so important. When you hear alternative, that means it's being used instead of conventional medicine. That's a huge red flag. Complementary means it's used alongside it, which is where your expertise on interactions comes in. And integrative, that's where healthcare is heading. It's about combining the best of both worlds based on actual evidence. So, CAM is really just the big umbrella term. It's the catch-all for basically any health practice or product that falls outside of what we'd call conventional Western medicine. It's a huge, diverse world. Okay, so we know what it is, but who's actually using it? And, probably more importantly, why? If you can understand the who and why, you're in a much better position to start that conversation. You know, the user base is really varied, but we do see some pretty clear trends. It tends to be more common among women, people with higher education and income levels, and also within specific cultural communities that have their own rich traditions of medicine. And this is so crucial for you to understand. A lot of the time, the driver is a chronic condition. Think asthma, migraines, fibromyalgia. These are patients who might feel like conventional medicine isn't giving them all the answers. They're not trying to abandon your advice. They're desperately trying to find something that helps. Now, this world of CAM can feel, well, overwhelming. But the National Center for Complementary and Integrative Health, or NCCIH, breaks it all down into 5 main categories. It's a really helpful way to get your head around the whole landscape. First up, you have whole alternative medical systems. We're talking about complete systems of theory and practice that were developed totally outside of Western medicine, like traditional Chinese medicine or Ayurveda. The second category is mind-body interventions. This is all about using the mind's capacity to affect the body. Things like meditation, yoga, biofeedback, they're often used for things like pain and anxiety management. Okay, category 3. Now this is your home turf. Natural product-based therapies. This is the stuff filling up the aisles. Herbal remedies, vitamins, probiotics. This is where your expertise is needed most, day in and day out. Number 4 is pretty much what it sounds like, manipulative and body-based methods. So think chiropractic care, massage therapy, practices that involve moving or manipulating the body to restore function. And finally, we have energy therapies. Now, these are based on the idea of manipulating energy fields that are believed to flow through the body. Practices like acupuncture and Reiki fall into this category, aiming to fix imbalances in that energy flow. So when you look at that whole landscape, all those different products, practices, and systems, it becomes crystal clear why your role is so vital. With all this stuff being used, usually in secret, you really are the gatekeeper of patient safety. But here's the beautiful paradox. Even though your patients aren't talking, surveys show you are exactly who they trust for information on this stuff. You and their doctor. They want to ask you. They just might not know how, or they might be afraid of being judged. So what does that mean? It means you have to ask proactively. You can't wait for them to bring it up. You have to build specific questions. What vitamins, minerals, or herbal products are you taking? Right into every single medication history. This isn't just a nice idea, it's a recommended part of the best possible medication history guidelines because it prevents real harm. And this is exactly why you have to ask. You're guarding against herb-drug interactions, against poorly regulated products, against bad advice from a store clerk, and you're also protecting them from the indirect harm of choosing a less effective treatment over one that's proven to work. Your job is huge. Now, you might be wondering, well, where's the research on all this? And that's a fair question. It's important to know that getting solid, reliable evidence on CAM is really, really hard. You have issues with publication bias, products that aren't standardized, and how do you even create a placebo for something like acupuncture? It's a methodologically tricky area. But here's the bottom line. The future of healthcare is moving towards an integrative model, and that movement doesn't make you less important. It actually puts you right at the center of everything. Your ability to bridge the gap between conventional and complementary is going to be more valuable than ever. So, I'll leave you with this question. As the use of CAM inevitably continues to grow, how are you, in your practice, going to make this conversation a standard, non-negotiable part of every single patient interaction? Because knowing what they're taking is the first and most important step to keeping them safe.